Hello, everyone. Thank you for joining me today. My name is Renee Deloney, and I'm excited to present my DMP project titled Vaccination Through Education, Improving Influenza Vaccination Rates in Primary Care. The goal of this project was to explore how educational interventions alongside an immediate vaccine offer could help improve influenza vaccination rates in a primary care setting, ultimately leading to better patient outcomes. With influenza being a significant contributor to morbidity and mortality each year, increasing vaccination rates is a key priority in improving overall healthcare delivery. In this presentation, I will be walking you through the background and significance of the project, a brief review of relevant literature, the theoretical framework guiding this work, and the methods and results of this project. Before we begin, I would like to take a moment to express my sincere gratitude to my committee members for their unwavering support throughout this project. First, I would like to thank Dr. Sabrina Condon, my chairperson, for her expert guidance and insightful feedback. Her mentorship has been invaluable in shaping this project. I am also deeply grateful to Dr. Lisa Stewart, my second reader, for her thoughtful contributions and constructive suggestions. Her support helped ensure the rigor and depth of my work. Lastly, I would like to thank Dr. Al Bellard, my community member, for his perspective and commitment to ensuring that this project met the real-world needs of our community. Thank you all for your time, dedication, and encouragement. I could not have completed this project without your support. Influenza is a contagious viral disease that can cause significant social and economic implications, making it a major public health issue. Each year, influenza outbreaks lead to increased morbidity, hospitalizations, and even death, especially among vulnerable populations like the elderly, young children, and individuals with chronic conditions. In addition to its direct impact, complications from influenza include cardiovascular-related fatalities, neurological issues, renal failure, and secondary infections. The purpose of this quality improvement project was to increase the overall rate of influenza vaccines at a local primary care practice. The project's overall aims were to improve communication skills, to address patient concerns, optimize vaccine administration, address vaccine hesitancy, enhance patient education, and promote population health. Despite the availability of a safe and effective vaccine, influenza vaccination rates remain suboptimal. This project sought to address this issue by offering timely educational information along with an immediate opportunity to vaccinate. By integrating vaccination education into routine care, this project aimed to increase patient uptake of the influenza vaccine, ultimately improving individual health outcomes and contributing to public health efforts. Let's take a closer look at the 4 key themes that were identified from a review of the literature. Vaccine education. This first theme is about providing patients with accurate and understandable information. Education here means more than just handing out facts. It involves addressing common misconceptions, explaining how the vaccine works, and discussing its benefits and risks. The goal is to empower patients to make informed decisions about their health. Provider recommendations. This second theme emphasizes the pivotal role of healthcare providers. When providers actively recommend the vaccine, their endorsement helps build trust and reinforce the idea that the flu vaccine is both safe and essential. This personalized recommendation often motivates patients to follow through with the recommendation. Vaccine reminders. This third theme focuses on the use of reminders. This can be achieved through digital notifications, phone calls, or even paper-based reminders such as an influenza vaccine information statement provided during appointments. These reminders serve as important cues, prompting patients to take action and schedule their vaccination as part of their overall healthcare routine. Vaccine accessibility. Finally, ensuring vaccine accessibility is crucial. The literature shows that when the vaccine is easily available, ideally offered on the spot during a healthcare visit, it can significantly reduce missed opportunities. This approach minimizes logistical barriers like scheduling additional appointments or transportation issues, making it simpler for patients to just get vaccinated. Together, these themes showed that a multifaceted approach encompassing education, provider engagement, effective communication through reminders, and making the vaccine accessible can dramatically improve vaccination rates. This integrated strategy formed the backbone for this project and is supported by robust evidence from recent studies. Now we will walk through the methodology and design. This project used a quantitative exploratory method to determine whether a structured educational intervention with an immediate vaccination offer would significantly increase vaccine adherence. Before the intervention, the practice where the project took place did not have a standardized approach to promoting flu vaccinations. Therefore, this intervention aimed to address this gap by implementing a structured education program focused on improving access to vaccines and adherence to CDC guidelines. Electronic health records from patients aged 18 and older were reviewed during two specific periods: pre-intervention between January and March 2024, and post-intervention from October to December 2024. Data was analyzed using statistical software, and a power analysis was conducted to ensure reliable results with a significance level set at alpha 0.05. Now turning to the design. This project took place at a primary care practice in the eastern United States, serving a marginalized, predominantly ethnic minority population. A total of 154 electronic health records were reviewed, split evenly between the pre- and post-intervention periods. The inclusion criteria for participants included patients aged 18 to 65 with records from the January through March 2024 timeframe, patients under 18, over age 65, with documented allergies or reactions to the flu vaccines, or incomplete vaccine records were excluded. Before moving forward with data collection, the DMP committee approval was obtained. However, the DMP committee deemed this project was non-research, therefore institutional review board review was not required. The sample group in this project consisted of a diverse group of individuals with an age range from 18 to 65 years old. The population was predominantly made up of individuals from various ethnic groups, with approximately 80% representing multiple ethnic backgrounds, 15% identifying as Hispanic, and 5% as African American. Additionally, the data collection was inclusive of all genders, ensuring a broad representation of the population. These demographics provided a comprehensive snapshot of the diverse groups participating in this project. In this data analysis, multiple statistical tests were used to assess the impact of the educational intervention alongside an immediate vaccine offer on influenza vaccination rates. Descriptive statistics help summarize the vaccination data, providing a clear view of pre- and post-intervention trends. To determine whether the intervention was effective, a z-test for the difference of two proportions was performed. This test compared the vaccination rates before the intervention to after the interventions. The results showed a statistically significant increase, suggesting the intervention was effective in improving vaccination rates. Additionally, a chi-square test was used to determine whether there was an association between the intervention and vaccination decisions. The results of this test also indicated a statistically significant association, supporting the effectiveness of the intervention. A power analysis was conducted to ensure the sample size was adequate. The study achieved an impressive power of 0.99, which means there was a very high probability of detecting any true effects of the intervention. The p-value for the study was 0.00, which is well below the significance threshold of 0.05. This strongly suggests that the educational intervention with an immediate vaccination offer led to a significant increase in vaccination rates. Based on these findings, the null hypothesis was rejected, and it can be concluded that the intervention was successful in improving influenza vaccination uptake. The results of this quality improvement project showed a significant increase in the influenza vaccination rates following the educational intervention. In the pre-intervention group, 26 out of 77 participants received the influenza vaccine, resulting in a vaccination rate of 33.77%. In the post-intervention group, 61 out of 77 participants received the vaccine, resulting in a vaccination rate of 79.22%. This project had several key limitations that may have influenced the findings. First, the retrospective chart review design relied on previously documented data, which may have been incomplete or inaccurate. Second, participants' vaccination status was manually recorded. Due to a recent transition to an electronic health record system, some records were missing or inconsistently documented, especially regarding vaccination refusals. The COVID-19 pandemic also played a significant role. It likely impacted participants' willingness to receive the flu vaccine and limited access to healthcare visits, making it difficult to isolate the effect of the educational intervention. Lastly, participant feedback was not collected. Without qualitative data, such as surveys or interview, this study lacked insight into personal barriers, concerns, or motivators related to vaccine acceptance. Including these perspectives could have provided valuable context and direction for future improvements. The intervention used in this project was providing structured vaccine education with an immediate vaccine offer, which led to a clear increase in flu vaccination rates among patients. This approach aligned with the CDC and World Health Organization guidelines and helped bridge gaps in health equity. The use of the vaccine information statement was especially important in meeting the needs of patients with low health literacy or language barriers. Some key strengths of this project included the integration of educational series into mandatory staff training and the consistent use of the vaccine information statement, an educational tool that is both accessible and easy to understand. Another strength was the retrospective chart review, which provided flexibility to assess the impact after the implementation. In terms of generalizability, the intervention was simple and adaptable to other settings. Its success can be influenced by patient literacy, technology access, and the engagement level of providers. Looking at long-term sustainability, the vaccine information statement and training materials are now built into the practice's workflow, making this a low-cost and high-impact solution. Periodic feedback from staff will ensure that the materials remain relevant. In interpreting the results, education alongside an immediate vaccine offer clearly played a role in increasing vaccine uptake. The vaccine information statement also supported patients who did not have access to digital resources, though some patients, particularly those who were hesitant, may still require a more personalized outreach. For clinical practice, this project shows that empowering providers with education and vaccine reminders can be a simple but effective way to increase vaccine adherence. It also highlights the need for targeted strategies when dealing with vaccine hesitancy. Finally, from a policy perspective, these results support embedding vaccine education into clinic policy to promote health equity and improve preventative care outcomes. It can also guide policies that address gaps in patient understanding and adherence. As a future family nurse practitioner, this project has significant implications for my future practice, my future patients, and the broader healthcare community. First, integrating flu vaccination discussions into routine care will improve patient education. I will be able to provide evidence-based information on the benefits of flu vaccination, addressing common myths and concerns. By focusing on evidence-based practices, I can ensure that my patients are making the best decision regarding their health. This project has motivated me to increase vaccine acceptance in patients, ultimately leading to more people getting vaccinated. Most importantly, my approach will be patient-centered, where I respect the unique health beliefs of each patient while providing guidance and support for vaccination. For my patients, the primary benefit will be an enhanced understanding of the risks of flu and the benefits of vaccination. This will empower them to make informed decisions about their health. With the flu vaccines, patients will experience reduced flu-related complications and fewer hospitalizations, which is especially important for those in vulnerable populations, such as our elderly or individuals who are immunocompromised. Ultimately, patients will have improved health outcomes as a result of timely vaccination. On a larger scale, projects like this initiative will increase vaccination rates. This protects not only the individuals, but also the community at large. By reducing the number of flu-related hospitalizations, we can also reduce the healthcare burden during flu season. Health equity was the fundamental principle of this project. As a future healthcare provider, I am committed to ensuring that underserved populations receive the necessary education and resources to get vaccinated. Finally, completing the project reinforced the importance of collaboration in healthcare. I pledge to collaborate with all members of the healthcare team to ensure that vaccination efforts are coordinated effectively. By working together, we can ensure that our efforts are aligned, resources are optimized, and vaccination initiatives reach as many individuals as possible. Overall, this project focused on increasing flu vaccination rates within a primary care setting by implementing a nurse-led initiative. The primary goal was to enhance accessibility to the flu vaccine, educate patients on its importance, and address any concerns or misconceptions about vaccination. Through collaboration with the healthcare team, vaccinations were delivered efficiently and health equity was promoted by targeting vulnerable populations. The findings of this project demonstrated a positive impact on vaccination rates within the targeted group. By employing a nurse-led approach, more patients were reached, creating a more personalized experience. The success of this initiative reinforced the importance of nurses in driving public health outcomes and led to increased awareness of flu vaccinations within a community. In hindsight, more community outreach and partnerships with local organizations could have further extended the reach of the vaccination efforts. Additionally, further monitoring and follow-up after vaccination could help assess longer-term impacts and ensure sustained vaccination rates year after year. Moving forward, advocacy for nurse-led initiatives and vaccination efforts and other preventive health strategies will continue. There will also be a focus on expanding access to vaccination for underserved populations and exploring ways to integrate more preventative care into routine clinical practice. This DMP program has been transformative both professionally and personally. It has deepened my understanding of evidence-based practice and sharpened my leadership skills. The importance of collaboration and advocacy in advancing public health initiatives have been emphasized. This project in particular demonstrated the effectiveness of a nurse-led initiative in increasing vaccination rates and highlighted the power of nursing leadership in addressing disparities. These are some of the references that were used in developing and supporting this project. The references include research articles, clinical guidelines, and public health reports that helped ensure the project's alignment with best practices in nursing and vaccination efforts. I thank you all for your time and attention today. I truly appreciate the opportunity to share this project with you. The importance of flu vaccination, especially in underserved populations, is something that I am passionate about, and I hope this presentation has shed light on the positive impact that a nurse-led initiative can have in improving vaccination rates and public health outcomes. Thank you again for being here, and I look forward to continuing to work together and improve health outcomes in our communities.